everyone has the right to parent that child or children in safe and sustainable communities. And then everyone has the right to bodily autonomy. And what I love so much about this framework is that it can truly be applied to anything and everything. Like everything is truly a reproductive health issue, a reproductive justice issue. And I like that reproductive justice goes a step further than reproductive rights because it doesn't just focus on the legality of things. Like it's great if abortion is legal, but if people don't have access to it, then what does that mean? And reproductive justice calls us in to really think about those additional barriers. And so I think in my work, I have spent a lot of time really thinking about what does healthcare access mean? And what does it mean if our lever of change is not just policy?
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development, and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Kene Orakwue, MPH. Kene is a graduate research assistant at the University of Minnesota Twin Cities. They have worked on a range of projects related to health equity and structural racism. Kene is a reproductive justice and health equity scholar and practitioner dedicated to the dismantling of oppressive systems. They plan on applying their findings to real-world initiatives to improve the outcomes for Black birthing people. They conferred a Bachelor of Science in Public Health Services from the University of Massachusetts Amherst, a Master of Public Health in Health Policy and Management, also from the University of Massachusetts Amherst, and currently working towards their PhD in Health Services Research with an area of emphasis in Sociology of Health and Illness from the University of Minnesota School of Public Health. In today's episode, you'll hear and learn more about Kene's journey into public health being influenced by their personal experiences, reproductive justice as a framework that addresses systemic barriers, how a 4+1 Master of Public Health was so helpful in their focus, how their research experiences are developed and evolved through academic experiences, and why they are getting formal training in qualitative research and how it enhances research rigor, and much, much more. Be sure to hit that subscribe button, enjoy today's episode, and join the free community below.
Hey everyone, it's Kene Orakwue. I'm a health equity researcher, evaluator, and scholar, and you're listening to Public Health Careers.
Kene, welcome to the show. Very excited to chat with you today and learn more about your journey. I know that we've been connected on, I think we've spoken before online, as well as just been connected on Instagram. So looking forward to hearing more about your journey. How are you doing?
I'm doing well. I'm super excited to be here. Yeah, my journey has definitely been a roller coaster, so I'm excited to unpack it and to be able to share that with folks.
Yeah, and I look forward to learning more about it as well. So jumping into things, how do you identify and tell us a little about your personal background?
Yeah, that's a big question. So I am a daughter of immigrants, Nigerian immigrants to be specific, and I feel like I lead with that identifier just because I do a lot of work around anti-oppression, around racism, and that work really demanded me to kind of confront my identity. And so I do identify as a Black woman, but a lot of how I learned about my Blackness was through the lens of the immigrant experience and through the lens of my peers. And so that definitely influences my work. Beyond that, I identify as a PhD student. I identify as a dog mom. I identify as a Black feminist. I definitely wear a lot of different hats, but those are the top ones.
What's your dog's name? What kind of dog you got?
I have a 3-year-old German Shepherd named Zazu.
Oh, you got a big dog.
Yes.
I feel like you don't hear people having big dogs much anymore.
I needed a hiking buddy, so it made sense.
I love that. Love that. Awesome. Well, I appreciate you sharing that, and definitely appreciate you digging into like the self-discovery journey. I feel like oftentimes we do have to do as Black people, and like, what does our Blackness come from, and how does that relate to the work that we're trying to do, especially in public health, especially as a health equity researcher. So, looking forward to hearing more about like maybe how that perspective influenced you going into your PhD and thinking about a lot of the work that you're doing. But I appreciate all of that. And before we get into anything, like if no one is looking at this, like Kene's frames are really dope, and just the color schemes as well are really nice. So definitely go across to YouTube and look at it if you have not as yet. Um, so jumping into things here, your dedication to dismantling oppressive systems is evident throughout your work, as we'll talk about. How do you navigate resistance or pushback when advocating for equity and anti-racism in the public health sphere?
Yes. Okay, so I kind of love this question because it is a question that people ask me frequently. And I think the simple answer is I don't. I think a lot of times we go into this work and we expend so much of our energy trying to explain to people the validity of our research, explain to people the validity is why they should care, explain to people that racism is even real. And while that is important work, and I do appreciate those who are educators and those who that's their hustle, like that is not my job, that is not my role in this fight. And so I start my work from a place of acknowledging that these systems are real, acknowledging that these are systems that we need to dismantle. And so I do not expend energy to folks and that resistance of this is not legitimate. I extend my energy, being creative, throwing spaghetti at a wall, thinking through problem solving, and then also collaborating with people who are like-minded and who have similar goals. So that's my easy answer. I think the longer answer is, of course, there is always pushback, but I mean, I think that means you're doing your job correctly if others see it as a threat. So keep going, and then find the ways to engage and to be able to do the work, um, and get the work funded. That's the important part, um, without burning yourself out in the process.
Absolutely. I think burnout is a big part of this conversation. And I guess like to dig more into that, like how did you come to the perspective of I'm not even going to engage in those like maybe quote unquote lower level conversations because they're not serving the role that I want to do in doing this work and being kind of okay with that.
Yeah, so as I'm sure I'll talk about at some point on this podcast, a lot of my work is really influenced by Black feminists, and I use that word really broadly. I think there are the traditional scholars that we ascribe to that label, and there are other folks who preach and practice Black feminist theory and Black feminist thinking, but aren't necessarily published or formalized in the literature like that. But I think a lot about Toni Morrison. She has a quote that I'm not going to attempt to recap right now because I'm going to say it wrong. But it basically, essentially, is about, the role of racism is distraction. And so I think in applying that to the work that I do, the spaces that I exist in, and the communities that I care about and I'm passionate about. I don't dismiss the legitimacy of racism, but I don't expend extra energy on proving that it's real, because that within itself is inherently a distraction and it's a distraction from the work.
Well said, well said. And we love a good paraphrase, by the way.
Yes.
No, but that's so true. And I listen or watch, I should say, FD Signifier. He's a video essayist on YouTube, and I remember him saying something similarly. Like he doesn't debate. He talks a lot about like race and Black culture, and he talks about like how he doesn't like debate racism because it just like to your point, it's like what is that doing for me in like in the bigger picture of getting forward and doing the work. So appreciate that sentiment, and I hope that other people can really maybe work towards that so that we are just doing the work as opposed to talking about things that we have established as like facts um for a very long time.
Exactly. It's definitely hard. I will say that I did not get here overnight, but I think that there's just better places to put your energy.
Love it. And I'm not going to ask you on the spot, but Black feminism, like literature that you would recommend, definitely send that to me afterwards, and we could put that in the show notes. I would hate to put you on the spot for that right now, so, but we can get
Yes, let me think about it.
awesome. So, given your background in health services research and policy, what systemic changes do you believe are necessary to achieve equitable access to healthcare for all individuals, regardless of race or socioeconomic status?
Yeah, so a lot of my work is specifically influenced by reproductive justice. And so, for folks who are listening that are not familiar, reproductive justice is a theory, it's a movement, it's a framework. It was coined 30 years ago by 12 Black women, and they essentially did not see themselves being represented in the mainstream feminist movement, reproductive rights movement. And this was also around the time that healthcare reforms were being made, and they didn't see themselves represented in that. And so they coined reproductive justice, which has four main tenets. It's based around the human rights frameworks, and the tenets are everyone has the right to have a child if they want to have a child. Everyone has the right not to have a child if they do not want to have a child. Everyone has the right to parent that child or children in safe and sustainable communities. And then everyone has the right to bodily autonomy. And what I love so much about this framework is that it can truly be applied to anything and everything. Like everything is truly a reproductive health issue, a reproductive justice issue. And I like that reproductive justice goes a step further than reproductive rights because it doesn't just focus on the legality of things. Like it's great if abortion is legal, but if people don't have access to it, then what does that mean? And reproductive justice calls us in to really think about those additional barriers. And so I think in my work, I have spent a lot of time really thinking about what does healthcare access mean? And what does it mean if our lever of change is not just policy? Because, right, we have policy, and that policy is keeping a lot of these oppressive systems intact. And so that is where I spend a lot of my time, a lot of my brain space. I do a lot of maternal health work. My previous stuff has done a lot around maternal mortality and a lot around doula access, and that's a space that I'm still in right now. And so it's really just thinking about new and innovative ways to reimagine what access is, how to measure that, how to research that, how to evaluate that, and really how to put it into practice.
And if you met someone that was out in the field talking about reproductive rights and maybe you wanted to have that conversation with them to focus the conversation more on reproductive justice per se, what would the framing or how would you kind of approach that conversation?
Oof. Okay. This is not a question I've ever been asked before. I think the biggest thing is to meet people where they're at. And so, I think reproductive rights is a stepping point for a lot of people just because that's more so kind of the mainstream rhetoric that we see. And so I think I'd approach it of, hey, have you ever heard of reproductive justice? If they haven't, I would give them the history. There's definitely recommended readings, both books or just smaller, shorter papers. There's YouTube videos. I truly think reproductive justice is a framework for everyone. And so, yeah, I think you meet people with where they're at, whatever reproductive health issue that they're interested in, put that into the framework of reproductive justice, show them how that's a more helpful framework, and then you go from there.
Love it. Simple. And I think it always does naturally go back to like meet people where they're at and try to give them information that kind of gives them contextual sense of what you're trying to talk about. So appreciate that. So you work in academia. How do you see research institutions contributing to tangible changes in healthcare systems, public health systems to address racial inequities?
Mm. Omari, you're trying to get me in trouble here. Um, yeah, I think academic research is a really interesting place. Obviously, I have situated myself here because I think it does, allow us access to certain resources. But I also, too, am equally as critical of this space and the history and the harms that is has caused to certain communities. And so I think for me, I do believe that there is a power in research. I do believe that there is a power in knowledge production and knowledge sharing. And I think situating yourself with academic language and with those resources can be helpful. Um, and so, in thinking about it broadly and thinking about, actual tangible change towards racial inequities, I think for a lot of people, unfortunately, 2020 was the first time that they were awakened to any of this. And with that, we saw a lot of, funders really open their pockets too. We saw a bunch of health equity initiatives, whether that was call for papers or grants or what have you. And while that was super exciting, it's really interesting to be here now, 4 years later, and to see that a lot of those opportunities have closed. Some still exist and have been more fleshed out, and that's super exciting that, health equity is now being built into the mainstream conversation. But then there are other places and spaces where, yeah, racism was solved. We did that, and it's on to the next hot topic. And so that's frustrating. Um, but I'm now steering from the question. But I think it's really comforting that there are a lot of us in the space who do have common goals, are working with each other, are collaborating, reaching across the aisle, and are really pushing for both our research and our topics, our passions to still be a priority. And then on the flip side, folks who are also actively disseminating their research, so not just letting it be a paper, but following it, whether that's policy route or whether that is other more grassroots efforts. So I think there are pockets um, of places where people are trying to make change, and that is exciting to see. It's not perfect, but you can make that argument about anything.
Right, right. There's always the vessel for us to do the work, and it could. There are always pros and cons to all the institutions and systems that we exist in. And I think
Yes.
to the point of like knowing what your goal is within the system, as well as knowing how you can gain the knowledge and the skills for you to do the work and the things that you ideally want to do.
Yes. And at the end of the day, academia is another institution, it is another system. And I do think to do this work and to do this work correctly, it does require us to also be critical of that and to acknowledge our roles in that and to use whatever power we may have, and that looks different depending on what stage you're at, um, to try to, protect those that have lesser power than you. So it's not perfect, it's a work in progress.
Right. And it is our job, I feel like, to beg the question of the things that are around us. How can they serve us better? How can that especially the things that are built to serve us in that sense. What does public health mean to you?
Ooh, public health to me is everything. I think like the formalized definition of the science and art of the well-being of the population or whatever, um, which I think resonates. But I think for me, it's even more granular than that. It's, really giving everyone what they need to be able to thrive. And so to me, my inherent definition of public health has equity baked into it. Um, and it goes beyond above and beyond just meeting the status quo, but really pushing people to that next level, um, to be able to do all the things that they aspire to.
And before you were a health equity researcher and advocate, you started off getting your Bachelor's of Science in Public Health with a focus on global women's health from University of Massachusetts Amherst. Tell us about that process going into undergrad, and was public health your major going in? Tell us all about that.
Okay, so this is actually a super funny story. I think most people in public health kind of just stumble into it. I think a lot of people
Yes.
don't know what public health is. Hopefully that's changing, but even then, I think most people think it's just epidemiology, and there's so much more than that. But, anyways, I originally thought that I was gonna be a doctor. I thought I was gonna go down the obstetrics and gynecology route. And then about halfway through high school, I was like, that seems like a lot. Maybe a pediatrician. Um, Decided to shadow um, one of my nurse practitioners to, just be in that clinical space, and was also somewhat considering nursing. I picked all of my schools based off of their nursing programs, and about a month before college admissions or applications were due, I was like, I don't want to be a nurse. Um,
Mm.
so I applied either psychology or undecided to all of my schools. Most of them were small liberal arts colleges, though. So my options were really like psych or biology. And so I ended up sticking to UMass because it gave me the most options. It's a giant state school. And then I also had in state tuition. And one of my friends was a public health major. And I was like, oh, like, what's that? And she was like, I don't know. It's about people and it's about health. And I was like, perfect. And so I ended up switching into public health right before my fall semester started. And, we learned about the social determinants of health. And I was like, this is so fascinating because my whole life I had heard, right? Like, you got to be healthy, your healthy behaviors. And now I was learning about all of these other things that actually affected us even more. And that was really worrisome for me. But I think what really did it was that year, NPR was doing a series on the Black maternal health crisis in this country. And I ended up stumbling across one of the articles, and the story was about Dr. Shalon Irving, who was an epidemiologist at the CDC and had just accomplished a ton of amazing things throughout her career, and had died shortly after giving birth because she wasn't taken seriously. And in reading this story, I saw a Black woman who was doing all the things that I wanted to do. Um, and she was still a statistic. And I saw myself, I saw my sisters, I saw my cousins in that number. And I was like, absolutely not. I will not stop until we solve this. And so since then, I've been in public health, I've been in the maternal health space. I have worn different hats around that, but that was kind of what got me into it. And then I stayed because I saw tools that this field and discipline could offer that others really couldn't, just given the public health's interdisciplinary nature. And that really resonated with me.
Well, I appreciate that, and I'd imagine a lot of people definitely resonates with that story in a lot of ways. Funny that your friend was the public health major. Like, I don't know what that is,
I think a
but
lot of people that happens though. I was also an academic advisor back during undergrad and during my master's, and a lot of pre-med to public health, a lot of I don't know what to do, so I'm just going to do this. And then everyone just kind of finds their spot in it. And I think that's beautiful that public health is so broad that it allows for that. So it's a cool major. If any undergrads are out there listening and you don't know what to major in, public health.
absolutely. And while you were, I believe all these positions were while you were undergrad. Correct me if I'm wrong, but you were an advocacy intern at the March of Dimes. You were a research assistant at UMass Amherst, as well as a court intern at the Holyoke District Courts in Massachusetts, and a peer advisor for the school.
Yes, I wore a few different hats during undergrad. I don't even think those are all of them. But yes, those roles. Yes.
So maybe overview of like what were some experiences during undergrad, whether that's a class or a role that you had that maybe helped you figure out your next step, or helped you figure out that this will not be your next step.
Yeah, I think I had a lot of those, but I think it's hard to portray that zigzag. I feel like whenever I tell this story, it feels a lot more linear than it was. So after my first year, so after my freshman year that summer, I had the opportunity to study abroad in Ghana, with a program called Star Service and Study Abroad, and it was amazing. It was the best 6 weeks. And during that experience, we were in a local fishing village. There were a ton of different community initiatives, but I was specifically focused on the sex education one. And so I helped the community partners that we were working with develop their sex ed curriculum, and then went into local schools to help them teach it. And I think that was a really eye-opening experience for me, A, to reflect on my own sex ed and was I actually telling correct information? Um, but there I really saw firsthand what broader context, how important broader context really is. And so there were certain schools that headmasters didn't want to let us in, and they didn't have to because sex ed wasn't a part of the curriculum and they didn't see the importance. And there were certain classes where some students had some education and some didn't. There was classes where there was a range of ages, and I think I saw directly just how important the policy context was. And so I came back and I was like, I'm gonna be poli sci and soc and Afro, like I thought I was doing a million things. I didn't end up doing any of that. But then the next summer I ended up going into the advocacy intern position with March of Dimes, and I absolutely loved that position. It was great. I had the opportunity to work on doula access legislation in Massachusetts. I had the opportunity to work on, just smaller research for internal policy decision making. And that was really fulfilling because I was like, yes, like this will better the structural conditions that will then allow for the grassroots efforts to ease out the inequities that we were seeing. And so that's what kind of put me on the policy track. I ended up holding other smaller RA positions throughout, and then went on to do my master's in health policy as well. But the more I stayed in policy, the more I got frustrated that, that was just one very specific lever of change. And I felt like we were missing, again, broader context. I felt that we were missing theory. I felt that we were missing, just a deeper understanding of how did we get here. And so that's why I pivoted a little bit when it came to my PhD, still in public health, but my program has an opportunity for us to have different areas of emphasis. And so I took the sociology of health and illness route to be able to incorporate more of that sociological understanding, still combining it with my policy background to hopefully move us to a space of more critical change. So that's the path we're on now. I'm sure it will zigzag again, knowing me. But really, all of my experiences built upon one another, whether that was I want to do something different or affirming, yes, this is what I love doing.
Awesome. And I'll definitely ask some questions about that a little bit later on. But I appreciate like just the story up to now. It's like going in wanting to be a OBGYN, then a peds doctor, then maybe a nurse, then going to Ghana and doing sex education work, and really not like I think it's also interesting that the takeaway or the realization that you had there was that we're going to these different schools that we're getting either turned away or they're accepting our services. And how does this not be like universal thing? It's like the policies that are in place to really have the curriculum to teach this type of work, and then that was what got you going into the Masters of Public Health. So okay, love all of that. What were some takeaways that you had from undergrad?
Oof. I feel like a lot of my takeaways actually weren't professional and were more personal, which I think does end up being the journey and trajectory for most folks. But I think undergrad really challenged me to explore what my beliefs were, as opposed to, just maybe taking the beliefs that were given to me. Really encouraged me to think critically, and then whatever solution I landed on to stand 10 toes down in that. And I think that that was a very in, informative experience for me. I hate that it took me that long to get to that point, but that was my journey. I can't change that. So yeah, I think that was honestly kind of the biggest thing. I think there was just many experiences where I was forced to kind of, really reflect on who I was as an individual, what I wanted, and then how I was going to show up. And I think that's a lesson I still carry with me today, given just the trajectory I'm going down going back to your question earlier, thinking about resistance, I think a lot of that confidence that I was forced to build in myself is still with me today. Like what I am doing is not easy. There are people who don't believe in me. There are people who are challenged by my work, and that's okay. But in order for me to see the change that I want to see and the change that I believe in, it requires me to stand 10 toes down in it. And so I think that was one of the biggest lessons. Also, just trying new things, putting yourself out there, doing things past you wouldn't do. That's where growth is. And really, a lot of this work is about growth.
So you got interested in public health, got interested in the policy side of things. You went on to get a master's of public health in health policy and management, also from the University of Massachusetts Amherst. Tell us more about that thought process, and then maybe some of the experiences that you had during your MPH program.
Yes. So I was super fortunate that UMass offered a 4+1 program.
That's awesome.
I absolutely love those programs. It's
When,
definitely,
when, and before, like, when did you find out about that, and like, how did that come into your thought process of maybe doing grad school, and maybe explain that to other people, because UF also did that, and I think is a really awesome opportunity for people if they're able to get into those kind of programs.
yes. So I was aware of it as early as my freshman year. I don't really think I gave it much thought at that point, to be honest. But I was aware that it was an option. So for folks listening, if you're not familiar, a 4+1 is where you do your undergrad for 4 years and then you do an accelerated master's that last year. So you end up getting both your bachelor's and your master's in 5 years as opposed to a traditional six. In most programs, you start taking your master's classes during your senior year as well. And so that's why you're able to do it in that accelerated timeline. And so for me, I was aware of the program. I was aware that it was an opportunity. I was like, yeah, cool. Like, that sounds nice. I probably will do that. But it wasn't really something that solidified for me probably until my junior year. So at that point, we had to start thinking about applications, but I was also just trying to think about like what did I want to do. I had been thinking about a PhD already at this point, but I wasn't really sure. I knew I wanted to be a professor and that I liked the research environment, but I was also like, oh, like maybe I want to work a bit, maybe I don't. Do I want to go into a public health program? Do I want to do a sociology program? And so I actually ended up doing the 4+1 to give myself an extra year to think about things. And that was kind of my tactic. I really enjoyed my department. I had really great connections. It made sense for me to continue on there. And then it was also an environment that I was comfortable in that I felt would allow me to like figure out those big questions. Funny enough, I figured out my answer like the summer before I started my 4+1. I was like, I want to be in a PhD program. So I didn't really need that full year, but I think it was definitely helpful. It gave me a master's, and that does give you street credit. It gave me extra time to really narrow down my research ideas, and I think that has been super helpful for me now in my PhD program. And then also just the time to work on applications in still a stressful environment, but slightly it's different than being a senior in undergrad working on PhD applications as compared to being in your master's program. And then also the opportunity to do my master's thesis, which is a very small, small, small version of a dissertation, but again, just continuing to prepare me for my next step. So I really valued that experience. I really valued the time and the space to, just grow into myself. And I think that year was actually really helpful to set me up to be successful um, in my program now.
And what you said that you knew that you wanted to do a PhD. What made you realize that?
Yeah, so I actually skipped a huge key experience in my journey because, like I said, there was a lot of zigzags. So I also studied abroad in spring of 2020. We all know what happened in spring of 2020, so my trip was cut short, but I spent 6 weeks in Cuba, and it was also an amazing experience. For those who don't know, Cuba has a really robust healthcare system and medicine infrastructure, largely due to the US blockade. They've had to become sustainable in different ways. And so it was really interesting to be in a new environment and to see healthcare in a different way. Um, and I learned a lot about myself and about the world. But in that experience, I saw myself just having more and more questions and wanting a way and a place and an opportunity to be able to answer them. And then I also had a professor at the time who had gone on the trip with us. And she gave me feedback on one of my assignments. And she was like, if you do not get a PhD, I will bully you until you do. Which a professor definitely should not be writing on any student's assignment. But I think that really did solidify it for me, being able to have someone who was on the other side see my thought process in action and be like, yeah, like you would be really good at this. Your knowledge would be really valuable, was really validating, especially for me. I'm the first PhD in my family. I don't really know a lot of other PhD holders in my family. There's a few, but they're more extended. And so to have that support was really impactful, and kind of put me on the right track to then think through the application process.
Yeah, it truly is validating, and I think like that's why it's so important. Like looking back on whatever wherever we are in our journeys, is just to like say those kind things to people, and like maybe you're thinking something, just say it to them, because you never know how impactful that thing that you write on someone's paper or tell someone is to that person. So just be kind.
100%.
Okay, so earlier on, you were saying as you're going into your PhD, you weren't sure if you wanted to focus specifically on policy. And then you also shared that you chose this program, or you like the program that you're in right now at the University of Minnesota, because it allowed you to do both maybe the policy and the sociology of health and illness. So tell us more about like that thought process and how you came to deciding this program was the right fit, and how you envision this maybe like taking it forward as opposed to like just that policy specifically.
Yeah, so I truly stumbled into this. This seems to be a pattern for me. I had a long list of schools that I was interested in their program. I had narrowed it down a little bit, but I was like, I still need to narrow this down more. I'm not really sure how to go about this. And it was a broad range of programs. I had everything from medical sociology to like just traditional public health. I had health services research. And so they were kind of all over the place. And I was like, I don't know, like, I just want a PhD. Um, but I think the biggest advice that I have for folks applying to PhDs, because this is what I ended up doing, was A, really look at the classes that are being offered. And so I looked at the course list. I was like, I don't really want to sit through half of these. I'm not going to go there because I would sit through them and be miserable. And then also understanding that a PhD is a huge investment. This is 4 to 5 years plus of your life. And so there was a lot of schools on my list that I was like, I don't actually want to live in this location. And so I ended up cutting my list significantly. And I actually wasn't going to apply to this current school, but my master's advisor at the time is an alum of this program and spoke really highly of the program and of the faculty, and attested that I would be a really good fit. And so I trusted her. I applied. My logic was apply and let them reject you. Like, I don't need to reject myself from these institutions. And
Hmm.
so I kind of just applied. And I was like, we'll see where I get in. We'll see which gives me the best financial package. Also, too, I wasn't opposed to working for a year or two and then applying again if I didn't like my options. But I ended up applying. I ended up getting in here. I liked the package that they offered me. And realistically, I didn't want to work. I did really want to be a professor, and I needed a PhD to do that. I've now since changed my career aspirations, but that is okay. So yeah, with all of that, I just kind of stumbled into this, and it has been a journey again of just being able to, explore myself, explore my interests, and have that evolve again based off of my experiences.
You also shared earlier that the 4+1 kind of allowed you the time to maybe get more narrow on what you wanted to study, what your dissertation was focused on. Maybe tell us more about how that process helped you, as well as what is your area of focus.
Yeah, so I think during my master's, I definitely knew that I was interested in maternal health, knew that I was interested in maternal mortality and doulas, but I feel like a lot of our undergrad training and even a good portion of our master's training is really just giving you the terminology and the tools to be able to go out and to do this work. And so while I had had a few smaller RA positions, I had done a little bit of evaluation, I had done a little bit of qualitative work, I hadn't really had the time to like think about my own ideas or think about my contribution to literature, what holes that I saw. And so my thesis was kind of my first opportunity to do that a little bit. My master's thesis ended up looking at different ways to evaluate a hospital based doula program. And so, in order to do that, I did do a miniature literature review. I was able to compare and contrast different frameworks, and I ended up choosing a framework and then applying it to the program that I was evaluating for this assignment. And then in all of that, that was really kind of where a lot of my questions stemmed from. I saw a lot of problems, to be completely honest, and I was like, well, this is problematic, but I can't solve everything in this one paper. And so that was really my first opportunity at that thought exercise, and I think was really influential for me because then when you get to a PhD program, you hit the ground running, you're learning different research methods. And I think it's helpful when you have a topic or at least a few topics that you're interested in, and then you can apply your coursework back to that material so things feel more grounded, more situated. And so, yeah, I think my 4+1 was influential in the fact that I was able to try out different topics in my different classes. I was lucky enough to be able to do a thesis that I was super interested in, and that kind of kickstarted a lot of brainstorming for me that still is alive and present today.
Oh, I appreciate that, and that is I think it's good to hear that because it just helps other people think about how can I really like come in and maybe understand that this smaller project that I'm working on right now might give me the spark to say, oh, I want the answers to these questions, and I might need to pursue additional education to kind of like guide that as well. So that's cool. You also spoke about the actually, before I get to that question, earlier on we were talking about how Black feminism is something that you embody in your research and the work that you do. How do you pull that into the work you do as a researcher, as a PhD student?
Yeah, so I think unfortunately for me, I haven't really had formal Black feminist training. I'm not even really sure what that would look like. I, I took sociology classes, I took WGSS classes, I've taken a few African American study classes, and so I've had opportunities to read literature and engage in conversation with classmates, but a lot of it I've also done on my own, just things that I've read and processed, and then, maybe doing a little more research online of what is the conversation, what am I missing here? And so I think because of that and because of that embodiment, it isn't even something that I necessarily always seek out to include. I think just very much how I show up in my work is of the Black feminist tradition and is in alignment with my research goals and my other just larger personal goals. I think to give a maybe more tangible example, I think the smallest one I can think of is when I'm giving presentations, I typically start with a positionality statement. I know that those are a hot topic and I think there are very valid critiques of them, But for me, I approach it based off of the understanding from the Kabahi River Collective. They really truly remind us that the personal is political. And I think I'd be doing a disservice to my work and to my audience by not sharing the ways in which I am entering space, I'm entering my research, and what lenses I'm analyzing with. And so when giving a presentation, I have a little blurb that I edit based off of what the project is. And I share that as an invitation for the audience to be able to call me out on any potential biases. I don't just laundry list a bunch of identities. I don't really think that's helpful, but I talk through some main experiences. I talk through my training. I talk through, different axes of power and how that interacts with potential work that I'm going to present. And I think that opportunity of reflexivity has actually made me a stronger researcher. And it has allowed for people to ask questions of, hey, like, do you think your background in X, Y, and Z, potentially biased how you interpreted this? And I think that is what research is about. It's not necessarily supposed to be like, this is knowledge, this is truth, but it's a way to engage in a systematic conversation. And I think that's hard to do when we act like researchers neutral. And so that's one way. One of the ways Black feminist thought and thinking influences my work. I'm sure there are many others, but that's the first one that comes to mind and I think is the easiest to digest.
Yeah, I appreciate that, and I definitely think it is just important for all of us to show up, and like I think it's like to reflect on our own experiences and then show up as authentic as we can, and to your point as well, as like be held accountable to whatever standard that is that you want to be held accountable for, and because I think we all need that, and I love the positionality of you saying that um research is like a conversation, and I think that is something that we oftentimes miss a lot of the times, or we aren't able to have a lot of that conversation. So I appreciate you bringing that back into the conversation around this. um,
Oh, I'm glad. Yeah, thank you for giving me space for that. I think one other thing I will add is that it's definitely a learned practice. Like, I'm sure I'm not perfect. I'm sure there's things I'm missing. But as someone who does have a really big interest in qualitative research specifically, I do think it's even more important. And as someone who talks about Black maternal health experiences, who talks about death, honestly. Um, I think also my identity is tenfold more important in those situations. And so, yeah, I think just being able to name it opens that conversation, and it's a practice that I wish more of us would engage in.
and maybe what are some of the things that you say you are learning or getting from this program that are going to help you excel, whether that's qualitative, quantitative skills, I don't know, sociology of health and illness. I feel like there's a lot of cool things that you can learn around sociology that could be applied. So
Yeah, I think there's a lot of things. My PhD program is definitely interdisciplinary and is also designed in a way where you you have your formal classes that you have to take, but there's opportunities for you to choose classes as well, so you can also gear it towards your interests. I mean, I think the biggest thing at the end of the day is, right, you're getting the degree. That's what gets your foot in the door. That's what signals to people that you are a researcher, you are an expert. I think the next level is getting those research method skills. And so while I had done qualitative research previously, I had never taken a formal qualitative class. And so I had that opportunity, and that was amazing to, be able to have, laid out, this is how to do this. This is also a citation of how to do this. This is a talking point for when people tell you qualitative research is not as rigorous. And so to be able to have that formalized training was super important. And then I think also just being able to network. The people you're working with are your colleagues. You have no idea all the places that they're going to go. You have no idea all the places you're going to go. And I think I'm super, super lucky to have come in with an amazing cohort of brilliant people who I absolutely love working with and absolutely love learning from. And so being able to take classes with them, being able to engage in critical conversations, being able to read theory, That has really been impactful for me. And now I am transitioning out of the class space and into the dissertation phase. And so, really taking those lessons with me as I craft my own dissertation project, all the things. Yeah.
And what does a roadmap, or what does that look like for you as you're thinking about? And I know you might not have all the pieces together, and that's absolutely fine. But as you're thinking about, okay, I got to do this next dissertation phase, well, what are some of the things that you're thinking about as you're moving forward?
Yes, so you have to take your qualification exams. That looks different in every PhD program. And then you move on to your prospectus slash oral defense, and then you move into your dissertation phase. And so I have finished both of my prelim exams, which was super exciting, because those are big milestones. And so I'm now in the process of trying to draft up my prospectus, oral defense, and then pivot into that fully in the new year. But yeah, I'm super excited. My dissertation will be focusing on the evolution of doula discourse and just aiming to document that in order to engage in a more critical policy and access conversation. So be on the lookout for that. But yeah, that's kind of where I spend most of my time nowadays, just trying to figure out how to articulate that, looking for different grants, all of that administrative stuff.
And you alluded to it earlier that I lost my train of thought. But you alluded to, what did you allude to? You alluded Oh, yes. You alluded to earlier that you have changed your mind. You initially came into your PhD wanting to become a professor, and now that maybe journey has changed, maybe it will change in the future again. But at this point, where do you stand? Why has that perspective changed? Tell us more about that.
So I should probably give the asterisk that depending on the day, it hasn't changed. But I think really for me, I didn't fully understand the breadth of all the things one could do with a PhD. And the more time I spent here, the more options I'm made aware of. And so it's allowing myself to dream of other realities, is essentially what it is. But I do think that academia is a beautiful and amazing place. But I do think that for me, at least, the pressures of that job just seem to be a lot more than I might want to do. And so allowing myself to think of other things. I think working for a nonprofit or a think tank could be equally as amazing. You know, it looks different. That's a traditional 9 to 5. I wouldn't have opportunities to teach and mentor and advise unless I did like an adjunct or something on the side. But yeah, so I've just been thinking about where can I work and what environment can I work in that allows me to do the research that I want to do, that allows me to be supported in that. And then, like also I'm human. Like, who's going to pay me? What's going to give me the best work life balance? Like, there are other life things to consider too. And so, yeah, I think I'm open to anything. I think what's going to end up happening is when I'm ready for the job market, we're going to apply to both academic and industry and see what the best offer is. But I think I've just been in a phase of, yeah, like academia isn't the only option, and that is okay. That doesn't make you a failure, even if that's what you set out to do. And so, allowing myself to think of other um, configurations is, I think, the space that I'm in.
Change is a strength, so definitely like
Growth.
lead exactly, because we have experiences that we learn more about ourselves and this world that we live in. So definitely. And I completely agree with the trying to find things that I align, like life wise, work life wise. And you gotta take your dog out on hikes. You can't just like let the dog be at home. So these things are important. Things are important. So before we move on to the Furious Five, and I guess this question might kind of what you already kind of alluded to and what you're thinking about, but maybe you have a more specific answer. But where would you like to see yourself in the future?
On a beach
Hey.
in the sun.
A beach where? A
Uh,
beach where?
Anywhere at this point. No, I think for me, so much of my work is passion work, and I think that is a double-edged sword. And so for me, I'm envisioning myself in a reality that lets me do the work and all the things that I want to do. I envision a reality, a world where reproductive justice is actualized for everyone. I imagine a world where I'm able to work towards that goal and also able to take care of myself and take care of my dog and all the other things that life has to offer. And so I think that that could be many different places, but I think that's what I'm working towards. And I'm super excited to step into this next step and step closer to that goal.
Love it, and definitely support and advocate for you in that way. Before we move on, where could people connect with you if they're interested in connecting?
Great question. My socials are Kene. I haven't been as active as I should, but I am trying to. I really want to document my dissertation, so that is the plan. Um, if you have professional questions, feel free to reach out to me on LinkedIn, and I do have some healthcare consulting opportunities as well.
Awesome. And I'll be sure to link those below or in the show notes. But just go to the show notes page. You'll find all the information there. Um, okay, so moving on to the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Do it. And I know that's seems very not specific, but just do it. Public health is so broad. As I said earlier, I truly think that there's a place for all of us in this field. And so if you're interested in it, follow your interests. Don't worry about what looks good on your resume. Follow your interests, and you will fall into where you're supposed to be and run with it.
Number two, if you are talking to someone wanting to get into your position, what advice would you give them?
Hmm. Reach out to PhD students. I think that that's truly how you understand what the experience is at a specific program in a specific department, working with specific faculty members. And so, if you're interested in becoming a researcher, interested in becoming a PhD student, reach out to folks, whether that's on LinkedIn or some schools have like ambassadors posted on the website. I know that's what I did when I was applying, and ask the hard questions and go from there.
Number three, what's something you are working on improving in your life right now?
A lot of things. I think the biggest thing for me is time. I'm one of those people that if I am focused on something, I will sit and I will focus on it, and then 6 hours will go by. But that is not always healthy. So, yeah, I'm trying to get better at time blocking and keeping myself organized in that way. And also remembering that at the end of the day, this is a job. And so being able to take care of myself is just as valuable to the work.
Absolutely. Number four, professionally, do you recommend anything?
Everything and anything. Yeah, I think it's a lot of what I have been reiterating, and I hate it because I think if I was listening to myself and someone telling me to take care of myself and to rest and can't pour from an empty cup, like I would probably cringe a little bit, but I think that there is a lot. There's truth to those cliches. And so it looks different for everyone, but I'd encourage people to marinate on what that is for them and then do what is needed. At the end of the day, like these institutions can replace you, and you are just as vital and important to this world as whatever you may be pursuing. And so professionally, I wish more folks, especially Black women in particular, but I think that could be said for women of color and people of color, take care of yourself.
Last but not least, number five, if there was one piece of advice you'd give to your younger self, what would it be?
I would give my younger self a hug first and foremost. And then I think after that, I would tell her not to be afraid. I think my fear held me back from pursuing my passions for a really long time, or it forced me to like overthink about how to do it and then be super calculated. And I think that was, again, a waste of energy. And so I think I would tell her not to be afraid and to trust her gut, and you figure it out.
Love it. Kenny, I learned so much about you and about your journey, and I look forward to staying tuned to all that is to come and the content that you're going to make about your dissertation journey that I'm going to hold you accountable to. Um,
Yes.
but this was fun. Thank you so much for coming on and sharing your story and experiences with us.
Thank you for having me.
Yeah, and I look forward to having you in the future when we see where you do end up, and we could talk more about that then. Awesome. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to hit that subscribe button if you have not as yet. Leave a 5-star review and share us with a friend. Greatly appreciate you all. See you all next week. Peace, everyone.